as of recent, a lot of research has been going into depression. When we talk about treatment options, do you think the future is optimistic for people who are depressed? Are there new and
Yes and no. Well, first to say why I say yes, we do have, okay, the depression can be treated in, well, basically three ways or a combination. So, firstly, you can give medicines, and those medicines are called obviously antidepressants. And then, secondly, we can treat it with psychotherapy. Psychotherapy is a form of treatment where we use communication rather than words, rather than medicines, also called talking therapy. And then, thirdly, we have physical treatments. And the most good example of the physical treatment is electroconvulsive therapy or shock therapy, as it is called. Of course, there are other physical treatments that are used rarely for very severe depressions, which we will talk about later. So these are broadly the three categories. And the antidepressants are what we normally use in our day-to-day practice. And those are pretty effective, actually. We have a range of antidepressants now. So we have a lot of options. And what we know is that different people respond differently to different types of antidepressants. So we have to find a match. So if you find a good match, then they work roughly about 70% of the time.
how
Not
do you find that match, Professor Hangwell? Are there blood tests to find
Yes,
that match?
well, mostly we do it by trial and error. So if we're lucky, we get the match with the first or the second. However, we are now developing genetic profiling where we can identify your genetic profile, which predicts to which class of antidepressant you will respond. So that is available in some centers where you can profile and then decide to, we cannot pinpoint exactly, but we can say, okay, this class of antidepressant is more likely to make you well, and therefore it cuts short the time frame. So that is possible.
When we talk about antidepressant treatment, what is the duration we are thinking of for a patient?
Yes, that's a bit important because the antidepressants do not work fast. So that's something very important. In fact, the side effects of the medicines come first and the effect comes later. So what happens is most people, when they start on antidepressants, they feel worse because the side effects are fairly immediate. By side effects, I mean the effects that we don't want in a medicine. Those are called side effects, and those are unwanted effects of a medicine. There's no pure medicine. A medicine cannot work only the beneficially. It has always a downside. So, for example, if you take a very common antidepressant called the tricyclic antidepressants, they are likely to cause a lot of dry mouth and constipation, which can be annoying. So these are side effects. Now those come immediately. The effect comes after 3 weeks, 2 to 3 weeks roughly. We don't know why actually. We still haven't worked out exactly why any antidepressant takes at least 2 to 3 weeks to start working. So this initial period is very important to tell the patient, look, you have to be patient, don't give up, continue the medicine, and after 2 to 3 weeks, you'll start feeling better. So this lag period of antidepressant is a very important issue.
When we talk about side effects, some patients worry that they might get hooked on to antidepressants, or they might feel like a zombie, or that their feelings might be dampened as a result of antidepressants. Is this
Yes.
true? Is this what
Okay.
do you say to that?
Right. Actually, I think you are asking me two questions. One is whether if you use antidepressants, you become dependent on it, which means that even though you are no longer depressed, you cannot stop the medicine because if you stop, you get unpleasant effects. That's addiction or dependence, as we call it. The second question is, does antidepressants dull you, like, kind of dull your mood and prevent your normal functioning? Is it an artificial kind of, mood lifting? Right. Okay. So to the first question, is it addictive? No, it's a clear no. The antidepressants are not addictive. Only, of course, when you are used the medicine for a long time and if you stop abruptly for a few days, you can get some unpleasant effect, but that's not addiction. That's a withdrawal of the chemical. So they're not addictive. So when you stop, if you get depressed again, it doesn't mean that it's due to the medicine. Uh, that's a problem of the disorder. Right. So the second question, oh, does antidepressants dull your normal mood? No, not really. In fact, they will enhance your mood. So it doesn't cause any dullness. It does not make you into a zombie or any such thing. And these are all myths. So don't worry. It doesn't make you abnormal person. You come back to what you were before. Okay. I mean, antidepressants cannot make you a Superman or Superwoman. It can only bring you back to what you were before. So if you were a jolly person before, you come back to being a jolly person. If you were anywhere a miserable type of person, you would come back to that normal miserable person that you were before. So it cannot make you a different person. It will restore your what we call a pre-morbid personality back to normal. And that
Can
normal
you
is,
tell us? Can you tell us about talking therapies, which now seem to be very popular in the West and are now becoming very attractive to clients?
yes, I think in a way it's popular because people don't like medicines. They feel a bit frightened of swallowing a chemical. So they often, when you say, okay, we can do this or that, they will say, doctor, I think I will go for the non-medical option of talking therapy. However, having said that, the newer therapies are very effective. In fact, they are as effective as medicines. And then you might ask me, okay, why do we give medicines? Well, medicines are more convenient, and also most people can deliver it because the therapies or the talking therapies need specialized training. So a normal doctor may not be able to deliver this kind of therapy. So to access the therapists who are capable of delivering this therapy may not be that easy. So therefore, medicines will work. And also you can combine medicines with therapy, and sometimes that is more effective. So out of the therapies, there are a few identified therapies which are proven to be effective in depression. So running through the list, there are about four therapies. One is called problem-solving therapy, which is also a fairly simple one, which can be used by non-medical people. And then there's a therapy that was specifically developed for depression called interpersonal therapy, IPT. And then, of course, we have the most popular one and probably the best therapy called CBT for short, cognitive behavioral therapy developed by Aaron Beck. And that is the most widely used therapy for depression. Of course, now there are other therapies like behavioral activation therapy. And the latest is the third generation mindfulness based therapies like acceptance and commitment therapy or ACT. These also can be used quite effectively. So there's quite a range of therapies available which the patient or the person affected can choose from. However, the problem is the therapists have to be qualified in these therapies. You can't just go and do therapy without training. So to find a qualified therapist, so that may be a problem depending on where you are living.
And what duration are we thinking of? Is it the same as medication? Does it take a long time?
Uh, yeah, it will depend. Really, it will be longer than the actually not really. The therapies may take as long as the medicines. Usually, the treatment for depression, if it's your first episode, will be at least 6 months. Okay, 6 months, and the therapies also would probably last actually less than that. Maybe full course of cognitive therapy is about 20 weeks. 20 weeks. So that we are looking at yeah, something like yeah,
Months.
little less than 6 months. However, it depends. If you respond very quickly and you grasp the principles quickly, you might even respond in a shorter period of time. So I've seen some patients responding in 3 sessions or 4 sessions, and they go on to improve even without any follow-up. However, sometimes we combine as well, and that can be also useful strategy.
Do you encounter patients where the patient prefers talking therapy, but as a clinician, you find that medication might be more effective or is the more suitable option for a particular patient?
Yes, I think it depends on the severity of the depression. So if I get a person who is very severely depressed and has perhaps ideas of suicide and has a lot of amotivation and lethargy, they cannot participate in psychotherapy, because to participate effectively in psychotherapy, you need to have a certain level of energy and a certain level of concentration. If that is not there and that is impaired by the depressive disorder, we cannot start therapy. So I will, in that case, first treat with medicines and then later offer the therapy.
Finally, you mentioned that there is a very a more advanced form of treatment or a more invasive form of treatment called electroconvulsive therapy. Very briefly, can you tell us what that is about and how it
Uh,
works?
yes, Vashan, we'll talk about that in detail in another video, but to explain very briefly, this is of course the famous what we call the shock therapy that was kind of brought to the public's notice after the famous film One Flew Over the Cuckoo's Nest, which actually unfortunately brought a very negative view of electroconvulsive therapy. Of course, in the past, this well, therapy is where we pass electric shock through the brain. Sounds frightening, but with the modern machines and always we anesthetize the patient like for major surgery, but short time, 5 minutes. The patient won't feel anything, and it's a very safe procedure actually. The mortality rate is something like 1 in 40,000. Just to put in perspective, that is much less than a dental extraction. Okay, the dental extraction risk of dying is much more, and probably crossing the road, depending on where you live, would be also a higher risk. So, I mean, it's a very safe therapy. But however, in the public side, there's a lot of fear because you have to undergo general anesthesia. And so the resistance is actually the mind of the public. If we can give all patients ECT, the effect would be very good. And in fact, that's the only therapy that will work faster than medicines. ECT is the only therapy we have that will work faster than any medicine we have. However, at the end of the day, we can't give ECT forever. So to continue or to prevent, we have to add on a medicine. So ECT is only the initial treatment. So because of the public kind of aversion and also the need for general anesthesia and the requirement for ECT suite, we reserve the ECT for people with very severe depressive disorder. For example, especially if somebody is after delivery and has a severe depression, we will give ECT because we need to get the mother back to normality as quickly as possible. So that's ECT, but we will expand on that on a different day.